Christos Anesti, Christ is risen. Good afternoon, everyone, and good evening to Dr. Sophia Stergakos and Dr. Martha Tsarkalis as we gather for our second video on our experiences with COVID-19, as these two wonderful doctors within their own practice are dealing with the effects of coronavirus, mostly on the phone with their own patients, and being able to offer so much help to so many people. We thank both of you, Dr. Sophia and Dr. Martha, for all the work that you're continuing doing and for all the sacrifices that you're making. Dr. Sophia, are you well? I hope everyone is well and healthy.
Thank you, Father, as well, for all that you do.
Thank you. Is everyone healthy? Everyone's well?
Very healthy. Thank you.
Good.
Thanks for asking.
Dr. Martha, you're still well?
Very well.
Good. Thank God. Thank God. We had a nice conversation last week, which focused primarily on the experiences of coronavirus, you and your aunts dealing with COVID-19 from various practices and experiences, and how those situations can really weigh on you spiritually as well as mentally and emotionally. We had a great conversation, and I was enlightened. I was intrigued by our conversation. I learned a lot, and I thought that it was a worthy project that we did, just to spontaneously make a video and say, these are some of the things that we're dealing with. This is how it applies to our everyday life. Most importantly, because we're on the phone a lot, we're chatting or we're texting or emailing, a lot of these conversations just naturally happen. But I think it's important to bring them to other people. And already you have provided a lot of help and a lot of advice to many people. So I feel like this is a worthy thing to do. And hopefully we can continue these conversations in the future. So I thank you very much. Thank you for your time. Thank you for giving up your rainy Saturday on Memorial Day weekend. Not that we have anything else to do, because we're not going to the beach, we're not going to the barbecue, we're not doing anything.
There's nothing to do.
Might as well talk about COVID-19. There we go.
A little more.
So since our last gathering, I'm going to ask Dr. Martha, because we already spoke about this a little bit. From where we are right now, Saturday evening, in the last, now I think it's been 36 hours, houses of worship have been deemed essential, and President Trump has asked us to reopen our houses of worship. But in Suffolk County, where we are, we're in a different situation. But you were telling me something about the ICU beds. Can you explain that a little bit?
So what I think a lot of the confusion is that, okay, Stop and Shop isn't essential, so I could run in and go do my thing and go shopping. Why can't churches be open? The problem that we run into is that 10 becomes 15, 15 to 20. We have carriers. You want to go in and you want to go out. I don't see how in a place of worship they could still go in or out when we're not at that perfect capacity of having enough availability of ICU beds. I think that's what the problem is. What happens if we have a second wave and it comes within the next 5 or 6 weeks? So what they're trying to say is that essential, we need food, water, we need things like that. And I understand there are other items that shouldn't be open, that are where people say liquor stores are open, but why can't a house of worship be open? They get a little bit confused with that. And I get that. That's totally understandable. But to be safe, for safety reasons, I really think that we should wait a bit until we have enough ICU beds available in Suffolk County, which is not yet at that peak yet, where we have enough, God forbid, we have a wave of something coming, and there's not enough availability. So once that capacity of the ICU bed is lifted and people aren't admitting as much patients, that's what Suffolk County is doing their curve at. The dilemma is that, why is this open but that isn't? It's hard to manage what it is. And there's some wrongs that should not be open, but there's rights, and people need food and water. And if you start taking that away, and we need prayer too, obviously, but through social media, we can have prayer the way you do every Sunday. And somehow as a community, we could kind of accept that for now until it's.
We've been saying we have to be, from day one, we have to be patient.
Yes.
And we have to allow this process to go through, because unfortunately, as we said last week, and I'm sure we're going to say again today, this is such a learning process for everybody. I didn't understand. Everyone was focused about a vaccine in the very beginning in dealing with coronavirus. And whatever the discussion is, 12 months to 18 months, I don't know when that begins, But now the focus is just on testing. At first, I didn't even care about testing. So what? We understand that someone's sick, but now it makes more sense, because if we know that someone is sick, that they've already had coronavirus, they currently have coronavirus, or even if they have antibodies, they know how to quarantine themselves and stay away from other people. I went for my antibody test last week. I got my results back that I tested negative for antibodies. So that means that I never had coronavirus. But now to go to Dr. Sophia for a second, how do you see the use of these tests, whether it's testing for coronavirus or testing for antibodies? How do you use this in your practice?
Sure. So it's still different. It's still very difficult to understand these antibody tests because they're new to us and they lack what we call specificity. They're not specific for COVID-19. And they're a good test to see if you've had coronavirus. And coronavirus has somewhere between, like we discussed with my sister, 80 to 100 strains. Coronavirus could have presented in the past as a common cold. So when you're looking for an antibody test, you have to always ask your lab, whether you go to Quest or LabCorp, you know what, hey, who's the manufacturer of this test? Because, for instance, there's a great manufacturer out of Switzerland, the Roche test, and they're known to have what we call high specificity, higher accuracy for that specific strain of COVID-19. So just having a positive test doesn't mean much. You have to interpret it based on, did you have COVID? Were you asymptomatic prior to having COVID? And once you do have this test, we have to ask, how high is the level of the antibody? Just like with measles, mumps, and rubella, right? When you go and you get retested for this, even though you've had a vaccine, these titers sometimes fall. So you're more prone to reactivation of the infection. And once patients have had COVID, they've recovered, they have this antibody, we're not quite sure how well their immunity, how long does this immunity last? Is it going to reactivate in 6 weeks, in 8 weeks? It's very hard to understand it still. You know, but it is promising. It's helping some people get back to work, which is very important. Essential workers, I understand, need to go back to work. We need our country to come back together, to start functioning, but we have to do it in a responsible way. So we don't really have 100% answers. And in addition to what I'm saying is we also have the nasal and throat swabs where we're testing patients with acute infection. They're presenting with fever, they're presenting with chills. Okay, do you have COVID? They go up, they call that 1-800 number, and they're, you know, located to the nearest site. Those tests also in the beginning of the infection have a 40% rate of false negative, meaning you really do have COVID, but you're testing negative. So that's very concerning as well. We've seen it with Martha multiple times. So we initiate the treatment of COVID, we retest them a second time, and I could tell you I've retested them, and on the third time, these tests become positive. So everything's still new. We're trying to perfect these tests.
So initially they tested negative for COVID, and then they tested positive, even though they were presenting symptoms?
Exactly.
Oh, yeah.
Wow.
Many of our patients.
I have a she's about 22, 23. She's had a fever now for 4 weeks, I would say.
Wow.
And she's like, if you don't, of course I believe her. I've sent her to a hem-oncologist. I've sent her to infectious disease. I've sent her everything. They're like, her COVID tests are all negative, 3 of them.
Oh my gosh.
And I'm just battling with her. I've put her on every antibiotic. I've done every kind of X-ray, CAT scan, and no one could figure. It's something COVID related that we cannot figure out. Yeah. So 3 negative tests of COVID with different centers of swab it's pretty alarming. It's
pretty analogous to Lyme's disease. We're still finding more and more research with that. So again, we're learning more, and we're hoping for the best, and we're trying our best in terms of treatment. Okay, so many of these patients, like Martha alluded to, they present with COVID. We have to act fast because this COVID leads to pneumonia within a second. And these are secondary pneumonias. They're not COVID pneumonias. They're bacterial infections. So you definitely have to cover.
I'm sure everyone has noticed this. There's more cars on the road. I feel there's a lot more people walking. For the first time, you go to the grocery store and there's actually stuff on the shelves. I feel like we're getting back to I hate to say this, like a more normal life while we're wearing our masks, while we're trying to maintain social distance. Whether we've tested positive or negative or antibodies, or we're going to be in society with each other. So Dr. Sophia, you had said at one point, well, we should be taking certain vitamins. We should be focusing on a non-inflammatory diet. You had mentioned to me one time. Can you speak about that?
Sure. And this is data that's been presented us for such a long time.
Mm-hmm.
How do we strengthen our immune system is something that we preach on a daily basis to all our patients. How do we fight the flu? It's flu season and whatnot. So
Mm-hmm.
the key is, being exposed to all these things and having your immune system at the best capacity you could have, having the best vitamins to protect you.
Mm-hmm.
For instance, because a low immune system, I come into contact with someone, I haven't slept, I'm eating poorly, I'm stressed, my cortisol levels are going up.
Mm-hmm.
I'm going to get that infection, and I'm going to get it in a different way that someone that's following a healthier lifestyle. Important vitamins are like vitamin D, for instance. That's a major vitamin. We have millions of studies that you could pull up in the literature that suggest that it fights any type of immune diseases, cardiac diseases, diabetes, whatnot. But here with COVID, what we've seen is it stimulates something called B cells. And that this helps prevent infection. It helps prevent that what we call inflammatory storm of COVID. They did this, we don't have any randomized control studies to date. Unfortunately, it's been presented to us since January. So we go by what we call epidemiologic data, whatever we could get from all the countries, from all the European countries. What we've seen is patients that were admitted with very low vitamin D levels and COVID infection had higher inflammatory markers, specifically something called CRP. And once that started, the storm started, what we call the complete attack of the body with COVID, sepsis, and they had higher mortality rates. The people that have start off with higher vitamin D levels do better. They recover faster as well. And this is something we're investigating.
What about diet though? What about food?
Diet. So where could you find all these things?
Because vitamin D, you can just take a pill and you're done. But
you can definitely, and you should be taking, because we've raised the standards of what's considered optimum now. Usually it was 30, now it's 40 to 60. You could take a simple supplement. You could, diet is very essential. We have salmon, we have avocado, we have eggs, basic things, anything colorful, fruits, milk, any type of, fish oil-based products. In terms of the sun, you get maybe 15 minutes, whatever you get in the first 15 minutes. After that, people sit in the sun for 2 hours. They're not absorbing much.
Arms, legs.
It's been a nice week. I've been out doing yard work, messing around with the kids in the yard, nice tan, vitamin D. But after 15 minutes, nothing happens.
No, not much. Your absorption diminishes. So, and plus, sunscreen. We have melanoma, we have basal cell. We don't want those things.
Wow.
We encourage diet. We encourage supplements.
Okay.
And endocrinologists also encourage, even booster vitamins. And now the other ones are vitamin C, very important. We're infusing them in the hospitals in our COVID patients. And that diminishes something called it stimulates something called natural T cells. And that stops the storm, stops all those radicals and interleukins, what we call that cause that storm of COVID. So what's vitamin C? It's your orange juice, it's your tomato juice, it's peppers.
How about everybody live a healthy diet? It's hard.
It is.
Listen, I know it's difficult. We're all in bad habits. I'm going to ask about masks right now. We're talking about bad habits. Governor Cuomo actually said something today that once masks were more readily available for hospital workers, the percentage of hospital workers that got sick, it tanked like so fast. So as soon as everyone had a mask, I feel like they were protected.
Right. I'll give you an example of us. Well, we were exposed to at least 3 weeks of the full-blown COVID epidemic that happened. And we were seeing about 50 patients a day, and a quarter of them were, maybe more than that, were COVID, 100 fevers, coughing, I have no taste. Coughing, and we were like, okay, it's probably COVID. We were wearing our protective equipment, which was basically a mask or a N95.
Right.
But it's very difficult to speak to patients, and they would pull it down. And I said, no, you got to wear it. We clean, disinfect. And honestly, out of 9 employees, including ourselves, no one got sick.
Thank God.
Thank
But I
God.
think, and you were more exposed as far as like your percentage of contracting COVID-19 was so high. And
Very
thank God
high.
you didn't get it because you had a mask.
I did have a mask, and I did proper hygiene the way I do normally for the last 15, 20 years. Washed my hands. I was a little, probably more cautious of not touching my face more than anything, or, you know, playing with my hair or whatever I do on a normal basis. But honestly, I always said it, I never really believed that touching surfaces and the wipe down was severe, except in a medical practice or in a hospital setting. I'm not going to go everybody's be like, okay, I can touch everything and we move along. But I never really at home, I never really wiped down anything or did anything besides take my scrubs, put them separate in the wash and move along. I never wiped anything down. I went to the supermarket. Obviously I wiped whatever I could, but in the office, the hygiene was, you know, we wiped and disinfect every 5 seconds with everything. People use nebulizers machines. We still had a separate triage room. But the masks, I personally believe, and a lot of people obviously don't agree, but most physicians and medical professionals agree that the masks do work. Otherwise, fortunately, we would have definitely been sick because we were exposed to that very bad strain that came over JFK or Europe. That's the strain New York got.
Yes.
California has a different strain. It's not proven, but the more I read, that's what it is. We have a completely different strain from Europe, and that was a lethal strain. And that's why there was such a bad impact in New York because of the subways and all that. And then California obviously was not as affected as New York, but we would have been sick, knock on wood, we would have 100 been sick if we didn't have our masks. So our mask saved us.
Right. One of the things that I'm worried about is, like you said, the rest of the country, between our area of New York versus the rest of the country. I feel like in our area, people are taking this seriously because we've seen people die. You have, I have, I've been on FaceTime, I've been on Zoom, I've watched people on FaceTime essentially take their last breath. And it was the saddest thing I've ever experienced. But we've seen this and we've experienced it. I think in other areas of the country, they haven't gotten there yet. God forbid they do. I'm going to say that. God forbid that anyone experiences anything that we did here. But when we talk about the seriousness of wearing a mask, I feel like the rest of the country is not there yet. And I am very frustrated by that.
I agree with you 100%. They don't. We're the United States is the Italy of Europe. That's what we are. And if you take Greece, which is a 45-minute to an hour flight from Rome, look at the dynamic. Whether they did something right or wrong, Italy got hit no matter which way, and so did New York. It was a lethal strain that hit both countries. But a mask does help. And people might argue with me, but they'll disagree. But I'll take myself and my sister and the other 8 or 7 employees, 9 of us, 10, whatever it is total, and tell you that none of us got sick. And we were in the brunt of that lethal strain. Had patients in the hospital on ventilators afterwards. And we didn't get sick, right? So nothing.
We have a lot of confirmed cases that actually ended up being COVID.
You as doctors were seeing patients first and early, and we in the churches and in the funeral homes were seeing them last and late.
Which is sad.
It was very tough.
It's even more difficult, Father.
Well, no, I mean, we had our masks, we had our precautions, we had to follow everything to the T, and we will continue to do so. But you know, these things are tricky, and they're very hard.
Whatever we did in the office worked.
I hope we can follow those same guidelines. All you were doing was following the rules, and us too, same thing. There have been many developments concerning the pediatric multisystemic inflammatory disease. Did I say that right?
Exactly, Father. Yes.
It's a lot. Okay, so what happened in like the last week? What have we seen and learned? Because the news is getting scary, you know.
The news is getting very scary.
Yeah.
And what happened is when school was still open in March, these children were becoming carriers and developing what we call an innate immunity. So they were, feeling better with the infection, going through maybe questionable little weakness, but they were infecting others at the time. That's why we had a lot of cases of teachers obtaining COVID. Now what we're seeing is something analogous to tuberculosis and mononucleosis, or even like the herpes virus, the chickenpox. Goes in your body, remains quiet, and it gets reactivated again. And what they're doing is they're not only seeing it in the pediatric population, mainly 8 to 10, but now we're finding it in young adults. At NYU, they have 80 confirmed cases, and they're investigating another 200 in New York City. And in the rest of the world as well, they're confirming some studies out of Italy. Again, a different mutation. In New York, actually on Long Island, we do have 2 confirmed cases. And how this disease is presenting is not Kawasaki, what people think, that hand and mouth disease, but Kawasaki written with a K, Kwasaki, Kawasaki-like disease, which is an autoimmune disorder. And what that does is it's viral induced, and what it does is it attacks the vessels of the heart. And that's very, very concerning. And these children may present with a red tongue, they may present with rash of of their fingers and their legs, fever, neck pain, abdominal pain. And what happens is what we're seeing is very rapidly, they get worse and their blood pressure drops and they need to be hospitalized. A very, very serious, overwhelming infection, yes. So again, we're doing studies on this. Hopefully they do well, the children. Now, not to alarm anyone, but a lot of these kids did have underlying issues.
Like what? We hear that on the news, like they had other issues, there were other medical concerns, like what?
Diabetes, juvenile diabetes. A lot of them had different forms of autoimmune diseases like juvenile rheumatoid arthritis-like diseases.
Oh, wow.
But not the 20-year-olds. And that's what's concerning. And these 20-year-olds are manifesting with chest pain and fever. And that's very alarming. So again, it's under investigation, and we have to, see furthermore what studies do come out this week and see how it's treated.
I have a patient now that is in her early 20s, another patient who has mono and COVID.
I did too, yeah.
I mean, it's insane. And we
which one do you think comes first?
I believe her mono came first.
Wow.
And I've seen 3 patients in their 40s that recovered from COVID in April and actually wanted to talk to my sister about this. And now they're presenting with mononucleosis with a positive test. Exactly. So again, the recovery phase of COVID is very, very serious. We have to, rest, sleep is very important, the diet and all these things, because it attacks the T cells. When you attack the T cells, you could have reactivation of certain other little bugs. Okay. So it's very important to understand. That's where the vitamins and all the diet and the sleep come into play.
I think it's 9 weeks now we've been dealing with coronavirus, and there were talks of vitamin D. There were talks of staying hydrated, obviously staying inside and quarantining and drinking a lot of water. But I think a lot of us are forgetting these things, and it's important to remain
and also
to keep that focused.
Mentally, yeah.
So mentally, the patients are exhausted.
Listen, you are mentally, physically, emotionally, I would say spiritually exhausted. We all are. Everyone is just, sick and tired of this. And this is a nice segue into the last topic before we shut down here. But the most frustrating thing that I'm personally experiencing is any talk of a vaccine. There's some discussion, again, whether it was Dr. Fauci talking about 12 months to 18 months. There was some talk about August, September, but that was back in March.
Sure.
And then, now there's other pharmaceutical companies that are coming up with a vaccine. I don't want to talk about when. I don't want to talk about when, but essentially, is this the most crucial thing that we can do to fight coronavirus, Dr. Martha? Is this literally like our only option that we have?
For me, 100%.
Yeah. I was afraid you were going to say that.
You do that, right?
Yeah.
without a vaccine, I mean, I'm like, go ahead, jab me 50 times.
Yeah, right.
I want a vaccine, and I want it now. What's realistic? We have to wait. I think they are speeding up the process, and they are going into phase 2, 3. Honestly, I could be completely wrong, but I believe by end of September, healthcare, military will get a vaccine. I think the U.S. has 300 million vaccines for their people. So I think moving forward, the most important thing is vaccination. There's no other option. We have no 100% therapy. We can't say, oh, we're going to have a therapeutic option, and then the only therapeutic option we have is get to the hospital, and this is what we're doing. That's what we have right now.
Right.
So for me as a physician, the hope I instill in myself is that I pray that we have a vaccine in September, October, the latest. Because if we get sick, how are we going to take care of all our patients? How are primary physicians, whether you're a pediatrician, primary care, cardiologist, gastroenterologist, how are you going to do an endoscopy? How are you going to change a pacemaker if we don't stay healthy to take care of everybody else on the outpatient basis? Hospitals have, a little bit more resources, but as an office setting, if we're not vaccinated and we get sick, we're down. We're down for 2-3 weeks, maybe 6 or 7. So vaccine is the only hope, so we could take care of all our patients effectively.
Listen, doctors are certainly essential. Everyone that, not just keeping our country running, but essentially keeping the world running. When we're speaking of civic leaders, when we're speaking of certainly healthcare providers, everything is the most important. As long as the most important thing, everyone just to stay healthy, to stay safe, and to be able to remain supportive of each other. We're praying for all of you. We always do and always will. And as we pray every liturgy, every service, scientists, we pray for our essential workers all the time and our doctors, but researchers and scientists, we say extra prayers for them and extra petitions for truly for God to enlighten them and for everyone to be able to remain steadfast and strong in everything that they do. But thank you for your time tonight.
Thank you.
We should name this show. We should turn it into some sort of like medical show. I feel
would be, it would be nice if people could submit questions to us. We would love to. I know we're not physicians, but I wouldn't mind answering questions just as a forum. If they had anybody in the church love to discuss anything or had questions, I don't mind.
I'm going to go back and make sure that, because I received many emails after our last video. I received many emails and private messages on Facebook and YouTube. I got some YouTubes, which was nice. And we touched upon a few of those things tonight. So God willing, we can meet again next week. I thank you for your time. It's always enlightening and education. I always learn something, and please know that we're praying for you and your staff and your receptionist and administrator that answers the phone. And maybe we got to get her on. We got to get her on here.
I said, you've got to get on. Come on.
We got to do it. So again, thank you for all your time and all your advice. And have a beautiful Memorial Day weekend, and we'll get together next week. Thank you. God bless you.
Bye.